Have you ever noticed bumpy, rough texture on your skin, but you're unsure what it is? Now, you might be having 5 of the most common body skin disorders. Now, in this video, I'll break down 5 common body skin disorders that you might be suffering from, what causes it, and how to treat it. And at the end of this video, I will share with you tips on how to prevent them from coming back in the future. However, we realize from analytics that most of you watching are not subscribers of this channel. So I have this one favor to ask of you, and it doesn't cost you any time and money. Click the subscribe button so that we can create better quality videos for you in the future. Great day, ladies and gentlemen, my name is Dr. Ingky, your digital skin doctor, and welcome to the channel whereby I share with you 5 of the most common body skin disorders that you might be potentially facing. So in this video, I'll break down the causes, how do you actually tell them apart, and what are the treatments that you can do from your own home. Now, let's start with disorder number 5, chicken skin. If you ever feel that your skin feels like sandpaper, especially on the upper arms or on the lower legs, you might be suffering from something called chicken skin. Now, medically, it is known as keratosis pilaris. This condition is due to an over build-up of keratin. Now, keratin is actually a normal protein in your skin, and you actually need keratin. And keratin has a high concentration on places like your nails and your hair. And that's what gives it that nice rigid structure. Keratin is also on your epidermal layer so that you do not always injure yourself, and it builds up the skin barrier. However, in keratosis pilaris, there's an overgrowth of keratin in your hair follicles. So what are the causes of keratosis pilaris? This is actually due to genetic predisposition. So if your parents suffer from KP, you potentially might have KP too. The downside of KP is there's no permanent cure. So how do you tell KP apart with other skin disorders? First up, it feels rough and bumpy all over your skin. Next up, there'll be mild redness of your skin, and it comes in small tiny bumps. However, when you scratch them, they do not bleed. So how do you treat chicken skin? First up, you need to exfoliate regularly. Using a cream or lotion with lactic acid, glycolic acid, or salicylic acid is very effective on reducing your chicken skin. Next up, moisturize with urea-based products or ceramide-based products. However, if you do the first 2 steps and it's still persistent, you might need retinoids like adapalene or tretinoin to increase the exfoliation of your skin. Now, there's a special fact about chicken skin. Research have shown that those suffering from chicken skin actually have lesser chances of suffering from acne. So in conclusion, although keratosis pilaris is harmless, regular maintenance actually reduces it further and helps control it. Condition number 4 is known as fish scale skin. Medically known as ichthyosis vulgaris, it's a genetic predisposition of your skin whereby the top layer of the skin doesn't exfoliate quickly enough. So you end up, you have this sort of skin that looks like fish scales. But do note that this condition actually worsens during the dry or winter season. So what causes it? Again, this is due to genetic predisposition. That means that you can only control it, but you won't be able to get rid of it. So how do you tell it apart from other skin conditions? Typically, it's on the lower limbs and on the upper limbs as well. They're thick, dry, and scaly, resembling something like fish scales. Now, treatment is rather straightforward. All you need to do is exfoliate and moisturize just like keratosis pilaris, using exfoliators like lactic acid, glycolic acid, and salicylic acid creams or lotions, and regularly moisturizing your skin with urea-based products and ceramide-based products. And if it doesn't go away, you can always top it out with retinoids. So in conclusion, regular moisturizing is key to controlling your fish scale skin. Condition number 3, ringworm. Now, despite its common sounding name, ringworm is actually not caused by any worms at all. Ringworm, or otherwise known as Tinea corporis, is actually a fungal infection of your skin. Now, this particular skin condition is highly contagious. That means it spreads from person to person. So what causes ringworm infections? First up, it's actually caused by a fungus called dermatophyte. Think of them as small, teeny, tiny mushrooms growing on your skin. So it's actually made worse by sweat and tight clothes as well. So how do you tell it apart from other skin conditions? It is typically circular in nature with red borders and a clear center, resembling a crater or a worm. Treatment is pretty straightforward. You can use antifungal creams like clotrimazole or ketoconazole creams. And if that doesn't work, you can use oral antifungal. But at the end of the day, prevention is better than cure. So make sure always shower or change your clothes after you sweat excessively. And the moment a ringworm starts to appear, seek for treatment immediately. Hey, before we continue with the video, let me know in the comments below if you actually exfoliate your skin and you actually moisturize, and share with us the brands that you're currently using. Now, skin condition number 2 is psoriasis. Psoriasis is a chronic autoimmune disorder that affects any part of your skin. And psoriasis comes in many forms. So what causes psoriasis? It's an immune system dysfunction that triggers excessive skin production by your skin. That means your skin produces the epidermal layer uncontrollably, and that buildup leads to something known as psoriasis. It could also be triggered by environment and lifestyle along with stress. So how do you tell it apart from other skin conditions? It's typically red in nature with white scales resembling snake skin. And if you scratch it, it bleeds. So how do you actually treat psoriasis? First up, we talk about topical treatments. Typically, it's steroid creams along with either vitamin D or calcium creams. And if that doesn't work, and now with modern medical breakthrough, there are injectables known as biologics to reduce your psoriasis. And if you have very severe psoriasis, you can actually undergo something known as phototherapy using UV radiation. Now, some unknown facts about psoriasis: it is commonly misdiagnosed with other skin conditions like eczema. And also in this particular research shown by the Journal of American Cardiology College, it shows that people with psoriasis have higher risk of cardiovascular issues. So in conclusion, although psoriasis is a chronic skin condition, proper management can significantly improve your quality of life. And the number one most common skin condition on your body is body acne. Why body acne occurs is a three-step process. First, your pores are clogged. Secondly, there's excessive sebum production. And third of all, there's excessive bacterial buildup. Body acne can actually get worse from tight clothing, friction with your clothes, and as well as excessive sweating. So how do you tell body acne apart from other skin conditions? It can come as small tiny bumps or big red bumps. And more often than not, if you pop it, there is pus in the middle. And one of the downsides of body acne is that it can lead to permanent scarring. So how do you treat body acne? First up, you can use body cleansers that contains salicylic acid or benzoyl peroxide. Next up, you can use creams that contains clindamycin, which is an antibiotic, or retinoids like adapalene. Third of all, you can use oral supplements like Clearit to regulate your skin health and to reduce your acne. Now, interesting facts about body acne. Now, in this particular research, it shows that close to 80% of body acne occurs in people suffering from severe acne. So in conclusion, small lifestyle changes and treating your acne as early as possible can prevent permanent scarring on your body. Now, before we wrap up the video, I'm going to share with general tips on how to look after your skin. There are three things to avoid. Number one, avoid tight-fitting clothes. Number two, avoid excessive sweating and bathe constantly. And number three, avoid excessive exfoliation. And the 5 things to do: number one, maintain proper hygiene. 2, drink plenty of water. 3, moisturize every day, especially when you have dry skin. Number 4, use sunscreen to minimize UV damage. And number 5, manage your stress because stress can trigger a lot of skin disorders. So alright guys, this is the end of the video. If you found this particular video helpful, please forward this to your family and friends, like and subscribe to the channel, and let me know in the comments below if you're currently suffering from any of these 5 common skin disorders. That's it from me. I'm Dr. Ingky, your digital skin doctor, and always remember to stay safe, stay healthy, and most importantly, stay informed.